What's good, YouTube? It's Jay, and I'm back again with another video. If you're a respiratory therapist student or graduate seeking to pass the TMC exam, then you're in the right place. Now, before we get into tonight's lesson, I just want you guys to know that we are still somewhat in a pandemic, and I want you to take care of yourselves. In a lot of places around the world, COVID-19 cases are increasing in a lot of the hospitals, probably where you work. Make sure you're wearing the right gear, take care of yourself so that you can take care of your family after you complete your shift. All right? Tonight, we are talking about modified ventilation, which means we're talking about modifying the PaCO2 for the TMC exam. Now, this can be a little overbearing, but it's not a lot of material because we're not throwing all the parameters on you at the same time. We're dealing simply with the CO2 tonight, and I can assure you, if you get these concepts, you won't have any problem on the exam when it comes to increasing ventilation. And without any further ado, let's do this. Okay, guys, as I said, we are talking about modifying ventilation. On the TMC exam, you will have to respond to your patient high CO2 levels. Now, remember that the normal CO2 is 35 to 45, but the CO2 represents our number one life function, which is ventilation. Whenever ventilation is compromised, we have to act. And tonight, we are correcting the patient high CO2 and the patient low CO2. So to begin our lesson, a PaCO2 of greater than 45 indicate inadequate ventilation, which simply means that you're going to have to make some changes to the ventilator settings. Now, there's three ways that we correct a high PaCO2. Number one, we increase the respiratory rate. Number two, we increase the tidal volume. And number three, we remove dead space. The amount of changes to your setting depend upon how far off the CO2 is. If the CO2 is off a lot, you will have to increase your respiratory rate without a doubt. And what I mean about a lot, I mean like 49, 50, 51, 52. Keeping in mind, the normal range is 35 to 45. When we are increasing the respiratory rate, you can increase the respiratory rate as much as you like to blow off that CO2. And the only reason I'm saying this is because I don't want you to get so hung up with the initiation of mechanical ventilation when the cutoff for respiratory rate is about 20, but the range is 10 to 20. So keep that in mind. If that patient has CO2 that needs to be blown off, then we need to increase that respiratory rate. Realistically, the rate changes that you will see on the exam will probably be no more than 2. That's usually all that is needed on the exam, a change in about 2. But be aware of everything. If the CO2 is off a little, then you can increase the tidal volume. But when you are increasing the tidal volume, you must remain within the patient's predicted body weight, which means that you must stay within a range of 6 to 10 milliliters a kilogram predicted body weight. So remember that. When you are increasing that tidal volume, make sure they within their tidal volume range. And lastly, if you only need to move the CO2 by 1, then you simply remove the dead space. First thing you do is increase the respiratory rate. Secondly, you increase the tidal volume. Thirdly, if necessary, when you have to move the CO2 by maybe 1, then you will remove dead space. I know this can sound confusing, but it's not really if you just take it one step at a time. So this is how we increase ventilation, or this is how we respond to a high CO2. Now let's talk about decreasing ventilation or decreasing the patient's CO2. In order to decrease ventilation in your patient, then you decrease the tidal volume first. The opposite of increasing ventilation. Decrease the tidal volume first. If the CO2 is off by only a few points, such as 31, 32, 33, 34, just decrease the tidal volume. Now, secondly, you would decrease the respiratory rate if you have a CO2 that is off about 4 milliliters of mercury. And what I mean about that is when you get CO2 of like 30, 29, 28, or 27. Then you can decrease the rate. If you only need a change in the CO2 of about 1 or 2, you can just add a little dead space. When we are decreasing ventilation, we add dead space. When we are increasing ventilation, we remove dead space. When we are decreasing ventilation, we are adding dead space. Now, for the exam, keep in mind that the respiratory rate and the tidal volume are the two controls that control ventilation. Rarely would you have to use dead space in real life to control your patient ventilation, but you may see this on the exam. There will be a ton of questions concerning a high CO2 and how you would decrease CO2. But you may see one question concerning dead space. But all you have to remember is that if that CO2 need to be moved about 1 or 2, this is when, if you are increasing ventilation, you remove the dead space. If you are decreasing ventilation, there you go. You add a little dead space. All right. So this is not very hard. It takes some time to sit down and figure it out in your mind. But just remember it this way. For the TMC exam, if you have a high PaCO2, you want to increase the respiratory rate, increase tidal volume, or remove dead space. If you want to decrease ventilation or decrease the patient CO2, you want to decrease the tidal volume first. Then you want to decrease the respiratory rate. And then you want to add a little dead space. Remember, for this exam is that they will test you in every way possible to make sure that you understand how to make these changes. And they want to also know whether or not you are following the rules when it comes to the patient high CO2 and a low CO2. This is very important for the TMC exam. Now, I ask that you just screenshot the board. The reason why I write on the board before my lecture is because it saves a lot of time, and then you can see the board fully to take a good screenshot at this board so that you won't have to try to take notes. Now, before we go, I have a question, and you should just pop it out right off the top of your head. If you have a patient with a CO2 of 55 is a lot. Remember, the normal range is 35 to 45. If you have a patient that has a CO2 of 55, what do? That's a lot now. That's right. You increase the rate in order to blow off that CO2. And there you have it. All right, guys, I'm back again. On the TMC exam, you are going to have to respond to either high CO2 or a low CO2. But if you take these tips in mind and play the video back a couple of times while you're studying some of your other material, then I can assure you, you won't have any problem in making those adjustments on the ventilator. Now, remember now, the respiratory rate and the tidal volume are the main controls when it comes to adjusting ventilation on your patient on mechanical ventilation. And there you have it. Hey guys, I'm working hard to earn your subscription to the channel in order that we can continue to make these videos, all right? If you would do me a favor, hit that like button, subscribe to my channel, share it with somebody else, turn on post notification bell, and until next time, we out.